Good evening, everyone.
Good
We're
evening.
beginning with the webinar today. So thank you for joining us on a Saturday evening. My name is Dr. Sandhya Sriram, and I'm a consultant physiotherapist at Precise Care Physiotherapy Clinic, Mulund. Today's webinar tells you how to not stroke out, a very meticulously planned session on a very important but common neurovascular condition. I would like to introduce you to the host of the session, although everybody knows her, none other than Dr. Lay Pathak, musculoskeletal physiotherapist and co-founder at Precise Care Physiotherapy Clinic. Dr. Lay has specialized in musculoskeletal physiotherapy as a part of her post-graduation program from MUHS Nashik. She's a certified instructor and trainer for Pilates, functional aerobics, sports injury fitness and conditioning trainer with additional certification as an orthopedic manual therapist. She's also a certified dry needling and a cupping practitioner. Dr. Lai has worked with various government and private hospitals as well as in rural settings herself. A passionate fitness professional herself, Dr. Lai has worked in Pune and Mumbai marathons as a physical therapist and also has conducted webinars on post-COVID rehab for COVID patients and general population. I welcome you, Dr. Lai. Over to you.
Hello. Am I audible?
Yeah, Dr. Lai, you are audible.
Yeah. Hello, everyone. Thank you, Dr. Sandhya, for a lovely introduction. I want to welcome everyone. Thank you so much for attending this webinar on how not to stroke out. So today we are going to learn mainly about how what is stroke, how to take precautions for it, how to understand that you're having a stroke, what are the immediate measures that you take when a person in front of you is having a stroke. So let's try to learn all this and to give us more detailed and detailed and a very perfect and precise information. I would like to introduce Dr. Nehali. So Dr. Nehali is a master's in neurophysiotherapy. She has completed her graduation from KJ Somaiya College of Physiotherapy and her master's from All India Institute of Physical Medicine and Rehabilitation. She is a certified neurodevelopmental technique therapist, NDT, and handles pediatric as well as adult cases. She has worked as a part of a neuro rehab team at Ghatkopar Brahmin Samaj and is associated as a consultant neurophysiotherapist in Precise Care Physiotherapy Clinic, Chembur. So now I would like Dr. Nehali to carry out this webinar ahead. Over to you, Dr. Nehali.
Taking today's session on how and thank you so much everyone for attending this webinar today on a Saturday evening. So let us begin without wasting any time. First of all, I would like to ask you all, have you ever seen anyone getting stroke, or have you ever identified okay, one person is getting a stroke? Anyone?
I have heard that the tongue goes to one side. I've heard such kind of messages in WhatsApp. Like I have not seen anyone, but I've seen the tongue turns towards one side. That is kind of a thing, which symptom, which is a stroke. Yeah.
Perfect. Very good. Anyone else? So after this session, henceforth, I'm so sure that you will be able to identify what is stroke, what are the signs of stroke, and will be able to understand the importance of early treatment. Okay, so I will start with sharing my PPT. Just a minute. Is my screen visible? Is the screen visible?
Yes, Dr. Nehali, it's visible.
Okay. Okay, so let's start. So, before we begin, let us see what are our topics of discussion for today. So our first topic is understanding what is stroke. Next is understanding what are the different types of stroke, risk factors for stroke, how to identify stroke, importance of early management of stroke, physiotherapy management, and in the end, we have a question and answer session.
Dr. Nehali, I think your PPT is stuck at one slide only.
Okay. Can you see all the points of the slide?
No, we are not able to see that.
Okay. Yeah, I guess it's visible now. These are the topics of discussion for today. Oh.
Yes, it's visible now. We can go ahead, Dr. Nehali.
Yeah.
Hello. I think Dr. Nehali's network is the problem. Just give us a moment.
Yeah.
Dr. Lai, can you help Dr. Nehali with the same?
Yeah, it started.
Because we are unable to hear her voice.
Yeah.
You able to hear it now?
Yes, the slides are changing.
Yeah. Okay, so first let me ask you all, what are the problems that you see in stroke? If you have seen someone suffering from stroke, or if you have heard about stroke, what are the problems that you have heard or seen in a stroke patient? Anyone?
Yeah, I would like to say, this is Sanjay. So last year, I was with one of my junior colleagues in Vijayawada, and suddenly he started talking to me in Telugu. So because I don't understand Telugu, he knows that, and suddenly he started talking in Telugu, and my visiting card, which was in his hand, it fell down. So I thought something is wrong. I admitted him in the hospital, and now he's okay. Now he's okay. So that was one of the things.
Okay, okay. Thank you so much, sir. Anyone else?
There is slurring of speech.
Yes.
My father had a stroke. He
Okay.
had left side and once then again on the right side. And
Okay.
after, so he was affected, the whole of left side was affected.
Okay, okay, okay. So
Then
like
he-
one side affection.
Yeah, and his speech and everything. Then it got better. Then, but at the end,
Okay. Okay, thank you so much, ma'am. Anyone else? listing down the problems that are seen in stroke. Just I think there are some network issues. Just give me a minute. Okay, so these are the problems that we will be commonly seeing in any stroke patient. So first is weakness in one side of body due to paralyzed muscle. As someone correctly mentioned, someone had a left side stroke and there was weakness on that left side of the body. So that happens again due to paralyzed muscles. Now, because there is muscle paralysis, what happens is the individual will have difficulty in standing or walking or performing activities, because for walking we require both our legs for walking, or for standing also we require a good control, a good balance. However, if you have one side affection, yes, definitely you will see problems in standing, walking. Next is stiffness or tightness, which we commonly call it as spasticity. Okay, now again, many of the patients also complain that their hands or their legs get really tight after a long time, or they have difficulty, or if someone else is trying to move their hands or legs, they will have this different kind of tightness which doesn't allow them to move their hands or legs. Next is reduced or abnormal sensations. Now, throughout the day, we have so many sensations around us, that is vision, hearing, or we have these sensations like touch, pain, pressure. In stroke, what can happen is you will have either reduced sensation, either you will not be able to feel things properly, or you will be having abnormal sensation. That means they will be abnormally heightened. You will feel that the sensations are increased. Okay. Next, a person can face balance problem. In the sense, again, the same thing. इंसान को खड़े रहने में तकलीफ हो सकती है. Then we have difficulty in talking, difficulty in eating. So stroke सिर्फ एक हाथ को या फिर एक पैर को ही affect नहीं करता है. It also affects the muscles of your mouth. Now, muscles of our mouth are so important for talking or for eating. Or someone mentioned about difficulty in moving their tongue. Yes, so it also affects the muscles of your tongue. You will have difficulty in moving in tongue, which is why you will also have difficulty in talking or eating. And then vision difficulties. इंसान को कभी-कभी blur दिखाई देता है और कभी-कभी कम दिखाई देता है, एक साइड का दिखाई नहीं देना. All these are again the problems that you will commonly see in stroke. Now, let us see what is stroke. But before understanding what is stroke, let us know a little about brain. थोड़ा brain के बारे में समझते हैं. Okay. Now, brain is like the master computer of our body. It will control all our actions. It will control our emotions, our movements, our thinking. It will help us to interact with environment. हमारे आजू-बाजू की चीजें समझने में और उनके साथ interact करने में brain हमारी मदद करता है. Now, this brain is made up of small cells which are called as neurons. अभी ये जो छोटे-छोटे cells होते हैं, उन्हें functioning के लिए blood supply, oxygen, nutrients की जरूरत होती है. Hence, brain is supplied by a lot of blood vessels which supply oxygen, nutrients to it. Now, what happens in stroke? So stroke, I have made this flow chart. What happens in stroke is first you will have loss of function due to disturbance in blood supply to the brain. That means अगर किसी कारण से ये ब्रेन को ब्लड सप्लाई नहीं मिल पा रहा है तो फिर ब्रेन के जो न्यूरॉन्स है, जो सेल्स है, उन्हें सही तरीके से ऑक्सीजन नहीं मिलता. बिकॉज ऑक्सीजन नहीं मिल रहा है ब्रेन सेल्स को, तो उनके डेथ होने के चांसेस बढ़ जाते हैं. दे डाई बिकॉज दे आर नॉट गेटिंग गुड अमाउंट ऑफ ऑक्सीजन और न्यूट्रिएंट्स. Now this is exactly what happens in stroke, that is loss of brain function due to death of the cells which are forming the brain. Okay. Now if you can see here, this is a picture of the arteries which supply your brain. Okay, तो अगर हम देखेंगे तो 3 मेजर बड़े आर्टरीज है जो हमारे ब्रेन को सप्लाई करते हैं. One is the anterior cerebral artery, second is the middle cerebral artery, and third is posterior cerebral artery. ये 3 चीफ आर्टरीज है जो हमारे ब्रेन को ब्लड सप्लाई देते हैं. अभी these arteries will supply different areas of our brain. Okay, now in the next picture we can see that we can see that our brain is now divided the brain into different parts. Now depending upon which part is affected, आपको अलग-अलग तरीके की problems दिखेंगे. तो आपको chiefly देखना है ये 4 parts of the brain, that is red, yellow, green and blue. ये हमारे ब्रेन के डिफरेंट एरियाज है जिसे डिफरेंट आर्टरीज सप्लाई करते हो और इनका फंक्शन अलग. तो फॉर एग्जांपल अगर ये जो रेड वाला हिस्सा है व्हिच इज कॉल्ड एज द फ्रंटल लोब, अगर ये अफेक्ट होता है तो इंसान के सोचने की ताकत, द इंटेलिजेंस ऑफ अ पर्सन, द एबिलिटी टू टॉक और एबिलिटी टू थिंक और मूवमेंट्स ऑफ द बॉडी आर अफेक्टेड. If the yellow part is affected, that is the parietal lobe, then you will see that the individual will have loss of sensation. लेफ्ट राइट समझने में तकलीफ हो सकती है या फिर कभी-कभी सेंसेशन ज्यादा फील कर सकता है एक इंसान. नेक्स्ट इज द ग्रीन पार्ट, दैट इज द ऑसिपिटल लोब. अगर ये पार्ट में कोई तकलीफ हो तो फिर इंसान का विजन में प्रॉब्लम हो सकता है. और इफ यू सी द ब्लू पार्ट, इट्स आल्सो कॉल्ड एज द टेम्पोरल लोब. इसमें कुछ प्रॉब्लम हो तो इंसान को समझने, इंसान की मेमोरी अफेक्ट हो सकती है or they will have problem in understanding what the person in front of him is saying, or they can also have a problem with hearing. So एक ही ब्रेन के अलग-अलग हिस्से हैं, depending upon which is affected you will see the symptoms. Okay. Okay. Now stroke is not of one type. Stroke के भी अलग-अलग types होते हैं. Now let us understand what are the different types of stroke. Stroke can happen because of many reasons, but chiefly these are the 3. So first is ischemic stroke. So ischemic stroke क्यों होता है? Any obstruction within the blood vessel. तो जो blood vessel, जैसे हमने पहले स्लाइड में देखा कि जो अगर किसी blood vessel में obstruction हो, obstruction can be because of anything, but mostly happens because of collection of fatty deposits in the artery. So collection of these fatty deposits artery को narrow कर देता है, और एक बार वो artery narrow हो जाता है उसमें से blood आगे निकलने के लिए तकलीफ हो जाती है.
छान बोलली, खूप छान बोलली. ठीक आहे, आम्ही ऐकतो बरं.
Because of which again the blood supply to the brain is affected. So this is same to same like heart attack. Heart attack में भी यही होता है कि हार्ट के मसल्स को ब्लड नहीं मिलता है और उसकी वजह से they will die because of lack of oxygen. Same thing happens in this. Okay, the next one is hemorrhagic stroke. इसमें क्या होता है? The artery which is supplying the brain will literally burst. Okay, the reason for bursting is because of high blood pressure. हाई ब्लड प्रेशर के कारण ये आर्टरी बर्स्ट हो जाता है and it will no longer be able to supply the brain with the blood. The next one is transient ischemic attack. अभी ये टाइप का जो स्ट्रोक है वो समझना बहुत जरूरी है. इट इज ऑल्सो कॉल्ड एज मिनी स्ट्रोक, ट्रांजिएंट. So transient means lasting for a short time. Okay, so transient ischemic attack मतलब क्या होता है? ये सिर्फ थोड़ी देर तक ही इसके सिम्टम्स दिखते हैं और फिर बाद में रिजॉल्व हो जाते हैं. So एक इंसान will start showing stroke-like symptoms which will go away on its own in 24 hours. So वो जो ब्लड वेसल है उसमें सिर्फ थोड़ी देर तक ये ऑब्स्ट्रक्शन रहता है, उसके बाद अपने आप ये ऑब्स्ट्रक्शन चला जाता है. But it is very important because this can be a warning sign कि आगे जाके stroke हो सकता है. Okay, so this is called as transient ischemic.
That was really insightful, Dr. Nehali. Hello.
Yes.
Yeah. So just to summarize in short, whatever we have learned till now. So basically, stroke in means that the brain cells at that particular area are dying, and according to those, the functions, the area which the brain is affected, उनके functions भी वैसे ही कम होते जाते हैं. Again, it was understanding these 3 types of stroke basically also gives us an idea about what precautionary measures we need to take. So like ischemic stroke mein the blood vessels are constricting, the blood supply to that brain area is very less. So we really need to see to it ki kahin pe blockages nahi hai, kahin pe the arteries are not having any kind of tension, that is blood pressure, या फिर ऐसे blockages like hypercholesteremia, then having high diabetes. So ये सब I think are good indicators or these things that will show कि कौन से type का भी stroke हमें हो सकता है, including the hemorrhagic and the TIA also. TIA is a very like important warning sign that we should be very careful about while progressing ahead with our treatments and everything. So Dr. Nehali, I would really like you to elaborate a little bit about these risk factors that we see in patients जिनको ये stroke हो सकता है or they are more susceptible to have stroke.
Yes, sure, Doctor. So let us see what are the risk factors for stroke. But first, let us know what are risk factors. Now, risk factors are anything that will increase your chances of getting stroke. It does not mean that if you have this, you will get stroke. It just increases your chances. Okay. So if you can see, divided it here into 2 different parts. Now the column on the left that you can see are the non-modifiable risk factors, and the column on the left that you can see are modifiable risk factors. Now what does it mean? Non-modifiable risk factors means these risk factors that you cannot change. These are not in your hand. Whereas modifiable means these are very well in your hand. आप इसे चेंज कर सकते हो, ट्रीट कर सकते हो, मैनेज कर सकते हो और आपके स्ट्रोक के चांसेस कम कर सकते हो. ओके, सो फर्स्ट हम देखते हैं व्हाट आर द नॉन मॉडिफाइबल रिस्क फैक्टर्स. सो दैट इज एज. फर्स्ट थिंग, एज द एज इंक्रीजेस योर चांसेस ऑफ स्ट्रोक इंक्रीज. So after the age of 55, the chances of stroke are said to be double. Okay, then again we come to gender. This was one of the questions that we had asked you, that you know that women have a higher incidence of stroke. So yes, women do have a higher incidence of stroke, especially post-menopausal women, because as we all know that there is a hormone called as estrogen, which is there in the body, which protects women against heart attack or stroke. After menopause, the estrogen levels in your blood reduce, which make them more susceptible to getting stroke. Also, women who are pregnant have higher blood pressure in general. So this again increases their risk of getting stroke. Or also women who are on oral contraceptive pills also have a higher chance of getting stroke. And the last is family history. If you have a history of stroke in your family, then yes, definitely your chances of stroke increase. Now, the second column that we see on the right are the modifiable ones, which are the factors which are totally in your hand. If you can manage these, you can actually reduce your chances of getting stroke. So first is diabetes. As we all know, we have heard people saying that diabetes might have a chance, individuals with diabetes might have a chance of getting stroke. Yes, because diabetes, having high blood glucose levels, having high blood glucose levels does form certain fatty deposits in your blood vessels, which will again narrow down your artery. Again, hypertension, high blood pressure, as we saw in the previous slide, जैसे हमने previous slide में देखा, high blood pressure होने के कारण artery burst हो सकता है, stroke होने के chances बढ़ सकते हैं. Next is hypercholesterolemia, hyperlipidemia. मतलब hypercholesterolemia मतलब blood में high cholesterol होना, and hyperlipidemia means blood में high lipid levels होना. दोनों के कारण वापस blood vessel में fatty deposits collect होने के chances बढ़ सकते हैं. Next is, as we all know, obesity and physical inactivity. मतलब मोटापा और activity level कम होना, sedentary lifestyle होना, इसके कारण भी stroke के chances बढ़ सकते हैं. Cigarette smoking, alcohol, again, is in general very bad for your health, but also increases the chances of stroke. And having history of cardiovascular disease, again, yes, can have, these individuals can have a risk of stroke. Okay, so now here is a small quiz. ये quiz आप खुद के लिए भी ले सकते हैं. This quiz is given by American Heart Association and American Stroke Association. So अगर आप देख सकते हैं, there is a green column. ये green column में सारे questions हैं, and there is a red column and there is a blue column. So red column is yes and blue column is no, depending upon what the question is. Okay, so अगर ये question का आंसर yes है तो आपको yes में 1 point देना है, और अगर ये question का आंसर no है तो आपको blue column में 1 point देना है. So would anyone like to volunteer and come ahead to solve the quiz and to see if someone is at a risk of getting stroke?
Anyone can participate. So basically, this is just a stroke risk quiz. At least you will know where you have to work on and how you need to control ahead. So if anyone would like to volunteer for this, we are just going to ask questions. You have to answer yes or no.
Yeah, I'm Gayatri. I'm ready.
Acha, you're ready? Okay, ma'am. Dr. Nehal, you can ask her questions.
Thank you so much, ma'am, for volunteering. Let us start with your first question. Is your blood pressure greater than 120 by 80 mmHg?
Yeah, yes.
Okay.
Okay. Next question. Have you been diagnosed with atrial fibrillation? Atrial fibrillation मतलब irregular heartbeats. ऐसे कभी आपको diagnose हुआ है?
Can you expand this? I'm not able to get you.
Okay, have you ever been diagnosed with any cardiac condition? कभी आपको कुछ cardiac condition diagnose हुआ है या फिर आपने कभी ECG लिया है?
ECG normal checkup के लिए लिया है, मगर कभी भी ऐसा कुछ diagnose नहीं हुआ है.
Okay, there is no problem.
So it's a no.
It's
a no.
Okay,
no.
Okay. Is your fasting blood sugar level greater than 100 mg per dl? आपका जो fasting blood sugar है, क्या वो 100 mg per dl से ज्यादा है?
No.
Okay.
Okay, good.
Okay. Next is your body mass index greater than 25 kg per meter square?
This is the body mass index, BM. I have not seen. Maybe, yeah, it is slightly more. Yes. Yes.
Okay.
So is your diet high in saturated fat or trans fat, sweetened foods, salt और calories? मतलब क्या आपके खाने में ज्यादा fatty चीजें हैं, sweet चीजें हैं, salty चीजें हैं?
No.
Okay.
Okay. Is your total blood cholesterol greater than 180 mg per dl? आपका जो regular blood cholesterol level अगर checkup होता है, is that more than 180 mg per dl?
1 second. Huh?
Last 6 months का भी कोई भी blood workup रहेगा तो चलेगा, no problem.
Ma'am, I've not taken a recent one. It's quite old, and I don't right now remember that.
Okay.
It was quite. Yeah, I see. I don't remember it properly.
No problem, no problem. So here
Do
we
you-
have an option of yes or unknown. So we will take unknown.
Unknown. Yeah.
Okay. Next, have you been diagnosed with diabetes mellitus?
No.
Okay.
Okay. Do you participate in 40 minutes of moderate to vigorous physical activities 3 to 4 days a week?
On an average, at least 3 to 4 days. Yes, I participate. Yeah.
Okay.
Okay.
So yes, but it will come in the lower risk
It will,
column.
yes, it will come in the lower risk column. Also, do you have a family history of stroke?
Family history of stroke? No.
Yes. No.
No.
Okay. Do you smoke?
No.
Okay. Okay. So here your total in higher risk is 3, and your total in lower risk is 6. Sorry, 7. So that means, so here we consider the total in the column where the total which is highest in the column should be considered. So if your total in high risk column is more, you're at high risk. If your total in low risk column is more, then you're at lower risk. So here your total in high risk column is just 3, and your total in lower risk column is 7. Good, you are at a very lower risk of stroke. That's good. You should continue the lifestyle that you are following, and also just once get your blood cholesterol level also checked, so you will be knowing exactly if you are lacking anything.
Okay. Thank you.
So much. Thank you so much.
Thank you so much for participating. That's really great. I mean, in this, we can at least, have a baseline where we lie if we are at a higher risk or at a lower risk, and the risk factors that have been enlisted in the green column. I think we can work on them to see to it that we stay in the lower risk zone only. So this was a really good stroke risk quiz, Dr. Nehali. I think we can go ahead then.
Yes. Now a very important question: how to identify stroke? Like a lot of you have already mentioned what you have seen when a person has got stroke. So many times it becomes very confusing whether this is stroke or what is it, or is it something else, until the symptoms become really severe. Okay, so एक small mnemonic है जो हमें मदद करेगा याद रखने के लिए what is how to spot a stroke. Mnemonic is B fast. Here B stands for balance. So जब भी किसी इंसान को stroke आ रहा हो, you will see that he is complaining of loss of balance. उन्हें लगता है कि गिरने वाले हैं, या फिर बहुत सारी बार they complain of चक्कर, dizziness. So they will feel that they are falling in one direction. They will feel that they are losing their balance. So this is B. Next is E, which stands for eyes. A lot of times the symptom of stroke can be blurring of vision. Now this sometimes comes as a first sign of stroke, that they will start seeing blur things. Again, this is just a symptom of stroke. Does not mean that अगर ये हुआ तो 100% this is stroke. This is just one of the signs of stroke. Next is face. Next is F stands for face. So one side of face will be drooping. So again, like we had seen earlier, it is just not paralysis of an arm or a leg. आपके face के मसल भी affect हो सकते हैं, और typically इन लोगों में facial मतलब जो mouth के muscles हैं, muscles around the mouth become weak. Then A stands for arm or leg weakness. So like commonly what we see here is एक side की कमजोरी लगने लगती है, they will start having difficulties in lifting their hand above to maybe pick up a glass of water, or they will start having difficulty in writing something. But chiefly it is seen that it starts from the shoulder. They'll have difficulty in lifting the shoulder for any activity. Also, they might complain of difficulty in walking. They might just drag their leg and walk. So this again, हमें ये पता होना चाहिए कि ये this is again one of the signs of getting a stroke. Then next is S. S means speech difficulties. So again, this is again one of the first signs that you will see if a person is getting stroke. इंसान को बात करने में तकलीफ हो सकती है. They will, you will not understand, like someone or previously mentioned, they will not understand what you are saying because the tongue movements are affected when an individual is getting stroke, and this can be one of the first symptoms to be seen. Again, ये necessary नहीं है. Sorry, the last one, T stands for time. That is time to call an ambulance or time to contact a doctor without wasting any time. Okay, so again, not necessary that you will see all the signs in this order only. शायद से हो सकता है कि सारे भी नहीं दिखे, एक भी दिखे, या फिर सारे दिख सकते हैं, but not in the same order. But any of this is a warning sign that an individual might be getting stroke.
Okay. I think this is a very simple and easy mnemonic to remember. That is, be fast. And we have to also act fast after it when we see all this like balance, eyes, face, arms, speech, and time. We need to keep a proper idea on this, how to react, and then call the ambulance as well. This is a really nice mnemonic. Thank you, Dr. Nehali. Also, I would like to ask you, usually when we say, many of the time, they tell ki it is very, very important to admit immediately. So in the last T also, it is mentioned that time is of a very great importance. So would you like to educate us on, how early it is necessary for us to contact the hospital and, to get that person admitted? And what are the risk factors that, again, we have to look for if we don't follow the time period?
Yes. So here, if you can see in this picture, the first picture that is on the left hand side, this is a picture of a brain when a person has got stroke. Okay. So the black area that we see is the tissue that is already dead. Okay. So कम blood supply मिलने के कारण ये tissue already dead हो गया है. And the area that we see, the orange area that we are seeing surrounding the black area is the other cells, ऐसे tissue जो weak या कमजोर हो गए हैं, but they are not dead. Okay, उन्हें सही समय पर ऑक्सीजन और ब्लड सप्लाई मिलने पे उन्हें हम वापस जिंदा कर सकते हैं. Okay, so the black area is the dead cells and the orange area are the still living cells, but they have become weak. This black area is an area of irreversible change. मतलब हम ये area को वापस जिंदा नहीं कर सकते. Whereas the orange area that you are seeing is the area of reversible change. After getting the right medical treatment, you can get that area back and you can make that area live again. So in the next picture on the right hand side, if you see, is the a picture of 30 minutes, 2 hours and 12 hours. So जैसे आप देख सकते हैं, जैसे टाइम गुजरता है from 30 minutes to 2 hours to 12 hours, ये ब्लैक एरिया जो है वो बढ़ते जाता है and ब्लू एरिया जो है वो कम होते जाता है. Okay, so once the time increases, हमारे हाथ में बहुत कम एरिया रहता है जिसे हम बचा सकते हैं. Okay, more the black area, more is the damage to your brain, and more the damage to your brain, more are the physical impairments that you will be seeing. तो अगर किसी को ज्यादा डैमेज हुआ है बिकॉज हॉस्पिटल जल्दी नहीं पहुंच सके, तो फिर उनमें ज्यादा इम्पेयरमेंट्स दिख सकते हैं, मतलब ज्यादा हाथ पैर का कमजोरी. Whereas अगर किसी को हम जल्द से जल्द हॉस्पिटल लेके गए, तो उसमें चांसेस है कि हम ये जो ब्रेन का एरिया है उसे बचा सकते हैं एंड उनमें कम फिजिकल इम्पेयरमेंट्स दिखते हैं, मतलब उनमें उतना कमजोरी नहीं होता है हाथ पैर का जितना अगर उस इंसान को हम बहुत देर बाद लेके जाएंगे तो होने के चांसेस। So like the question we had asked, what is golden period in stroke? So it is actually a golden hour, that is 1 hour 60 minutes. Okay, prompt treatment, urgent and fast treatment in these 60 minutes will help you to reduce the disability to a greater extent. तो किसी को स्ट्रोक के सिम्टम्स आने के बाद विद इन 1 आवर अगर उसे हॉस्पिटल लेके जाते हैं और उसे हॉस्पिटल में आईसीयू में सही ट्रीटमेंट मिलता है तो उनमें हम फिजिकल डिसेबिलिटी काफी हद तक कंट्रोल कर सकते हैं। ओके, सो दिस इज अ गोल्डन आवर इन केसेस ऑफ स्ट्रोक पेशेंट्स। Here as we can see, ऐसे बोलते हैं that 8 मिनट का डिले can cause loss of 20 lakh brain cells. Hence, time loss is equal to brain loss.
Okay. So we really have to be fast when a person is undergoing a stroke. That is very, very important for him to get the immediate treatment. Also, Dr. Nehali, we would like to understand, once a person has suffered a stroke, what are his chances of recovery and what are the different treatment aspects that we do in physiotherapy that helps them to regain their original activity level, and they can be again independent. Can they be again independent as before, or what are the chances of them to have all this residual weaknesses and everything in them forever? So can you elaborate on that?
Yes, sure, Dr. Nair. So we all have heard कि हमने बहुत सुना है कि स्ट्रोक के बाद फिजियोथेरेपी जल्दी चालू करो, और people have started with exercising, some doing something after getting a stroke and after getting discharged from hospital. So let us actually understand physiotherapy क्यों important है and not just क्यों important है, पर जल्द से जल्द चालू करना क्यों important है. So here are a few points making it clear that recovery of patient depends upon the extent of damage to the brain, age, etc. जैसे हमने पहले देखा, अगर ब्रेन का डैमेज ज्यादा है तो फिर अगेन रिकवरी, फुल रिकवरी होने के चांसेस कम हो जाते हैं. अगेन विद एज क्या होता है, एज के कारण ब्रेन में ऑलरेडी बहुत सारे चेंजेस हो गए हैं, प्लस स्ट्रोक के बाद फुल रिकवरी होना becomes a little difficult. Not just these, there are many other factors which can predict the recovery of a patient who has got stroke. Next, recovery takes place by virtue of formation of new connections. Now, what is this? स्ट्रोक के बाद हमारे जैसे इंसान रिकवर हो रहा होता है, हमारे ब्रेन में बहुत सारे नए कनेक्शंस बनते हैं. Now, these new connections can be good connections or they can be bad connections. Now, what does physiotherapy do? Is it will help in formation of these good connections in a right manner. Okay, so अगर हम physiotherapy जल्दी start करें, तो हम ये connections को सही तरीके से channelize कर सकते हैं, सही तरीके से mold कर सकते हैं. For example, you can take an example of cement. As long as the cement is wet, you can mold it the way you want it. But once the cement becomes dry and hard, you cannot do any changes in it. That means even in physiotherapy, you have something called as golden period. मतलब physiotherapy start जैसे ही इंसान को स्ट्रोक आता है, it is important physiotherapy जल्द से जल्द start हो, ताकि the new connections that are forming, we can mold it in a right manner. Okay, so rehabilitation मतलब physiotherapy treatment is the key in maximal stroke recovery, and ये stroke होने के 24 घंटे के बाद भी start हो सकता है, and it is supposed to be started within 24 hours or after 24 hours, but as early as possible. We will see maximum recovery होता है 6 months to 1 year post stroke. उसके बाद 6 महीने के बाद ये जो stroke का recovery है इंसान का, वो थोड़ा slow हो जाता है, but it doesn't stop. just like that, 6 months is a golden period for a patient for doing physiotherapy and recovering maximum. Now let us see what we do in physiotherapy. Hamara basic aim in physiotherapy is to get that individual back to his normal lifestyle, make him as independent as possible ताकि वो किसी के depend ना हो चलने के लिए या फिर just for doing normal regular work. The individual should not be dependent on anyone. This is our entire goal in physiotherapy. So what we do in physiotherapy, first is upper limb and lower limb voluntary control training. It means that you are just trying to get back the movement. So ये करने के लिए बहुत सारे तरीके होते हैं in physiotherapy. There are many techniques that we use to get back the movements that are lost because of stroke. Next is strength training. Strength मतलब again बहुत बार people with stroke have a weakness because इतने टाइम उन्होंने कुछ नहीं किया होता तो हाथ पैर में weakness आना is quite natural. We go for strength training. Then we have balance training. Gait training means again training the individual to walk on his own. Functional mobility training मतलब इंसान की जो नॉर्मल मोबिलिटी है जैसे एक साइड से दूसरे साइड बेड में रोल होना, सो के उठना, बैठ के खड़ा होना, ये सब जो चीजें हैं इंसान डे टू डे लाइफ में बहुत बार लगती है. सो आफ्टर स्ट्रोक लॉस्ट बिकॉज ऑफ वीकनेस, सो वी एज फिजियोथेरेपिस्ट we train them using different techniques. Then is sensory re-education. So like हमने पहले देखा था how sensation can be affected in stroke. अगर किसी का sensation affect है तो फिर balance में affection दिख सकता है या फिर एक normal glass उठाने में भी वो इंसान को problem हो सकता है because इंसान को sensation ही नहीं है कि glass का क्या feeling होता है या फिर एक button बंद करे तो finger में there is no sensation, so they don't know exactly what is the movement and how to do the movement because of loss of sensation. So we again retrain the sensation first, sensation of touch, sensation of pressure, etc. And last is pain relief. Yes, some patients after stroke do complain of pain. Pain because of stroke आता है, but it happens because हमने बहुत टाइम तक किसी मसल को नहीं किया होता है or the joints are stuck in one position. So they can complain of these small joint pain. Again, this is also a part of physiotherapy to relieve their pain which happens because of immobility या फिर less movement.
So basically, having physiotherapy or taking physiotherapy post stroke is really important, mainly to manage all the residual symptoms, especially of the muscles, because they are affected to a greater extent. The tightness of the muscle, the tone of the muscle is something that we really look and take care of, wherein it becomes easy for them then to rehabilitate into their normal routine or the regular routine. Also, Dr. Nehali, now we have seen what all different therapies that we take for stroke. But if an individual does not have anything, is at a lower risk of stroke as well, what is the main precaution that he needs to take, to avoid any kind of, moving into the higher risk zone or having stroke out of no reason? So there are many idiopathic changes also that occur and that lead to stroke. So in order to avoid all that, how it is, or how to keep us important, maintain healthy for preventing stroke?
Thank you so much for the question. So here we need to see that stroke. We know that stroke can be prevented, and most of the time stroke is caused because of some cardiovascular problems, which are totally in our hands. Certain lifestyle changes which are totally in our hands. Certain dietary changes which we can manage. Since we have a cardiorespiratory and a cardiorespiratory specialist with us, that is Dr. Nishi, I would like to invite her and ask her to please say a few words on prevention aspect.
Okay, so we have Dr. Nishi over here. She is a cardiovascular and pulmonary physiotherapist in Precise Care, working at Mulund branch. I would like Dr. Nishi to take over and explain us in preventing stroke.
Hello, good evening. Am I audible to everybody?
Yes, you are.
So I would like to thank Dr. Lai and Dr. Nehali to invite me to this platform. And thank you everyone for coming and joining us for this evening webinar. So specifically, hello, I just want to introduce myself. I'm Dr. Nishi. I'm a cardiopulmonary and rehabilitation specialist working at Precise Care. So why this is important for you? So I just want to tell you very in simple language that it is amazing that how precisely Dr. Nehali explained that why stroke is happening, how you have to take care of it, how you have to know that what is happening to you, and what physiotherapy management is required. So I just want to give you a major layout, not a very big thing, but a small thing, that the major breakout why stroke happens is not brain, but the major reason is your heart. It's always important for you to remember that a good heart health or a good vascular health. Vascular means the blood which is flowing in your arteries. That is the vascular health. If your heart and your vascular health is good, you will have no stroke or you will have less chances of having stroke. Very important, I want to just make you understand that we can take care of all these things just by changing few things. Like we can modify our routine, we can modify our lifestyle so that this all things is being cared and the stroke doesn't happen. So let's just a simple thing. If I tell you that you have to start exercising today, you have to take care of your heart today. I know major people will not do. मेरे बोलने से वो चीज नहीं होगी. So let's talk with numbers. I just want to give you a brief idea that in 2020, during the COVID time, in India, 1,85,000 people have stroke, and 50% of the people who are having stroke are a pre-diagnosed heart patients. So means heart problem can lead to stroke. Now I'll explain you how it happens is. Can you change the slide behind, please? I want to take the picture of the explanation. Can the slide go ahead, please? Yeah. So as everybody can see this diagram, it's a very simplified diagram. I just want to explain. So as you can see in your heart, there is blood. If any of the cholesterol or any of the thrombus, what do you mean by thrombus? I just want to simplify it. Thrombus is basically a fat which is being blocked in your artery. Imagine this is your artery. This is your cholesterol plaque. If your cholesterol is plugged here, okay, the blood flowing is not happening. Suppose because of too much of high blood pressure, a person is hypertensive, there is a sudden removal of this clot or this cholesterol, and that cholesterol can go into your brain. As you can see, these of your any of this thrombus, all the arteries go from the heart to the brain. So if the thrombus gets removed here, it goes from one pipe, it can go to the pipe of your heart, or it can go to the arteries of your heart. So if that thrombus or that cholesterol travels in the vessels of your brain, it can block the brain circulation and cause stroke. So if a not good cardiovascular health or not good vascular health or high cholesterol, high blood pressure can suddenly cause blockages in your brain vessels and give you stroke. So I just want to tell you a simple thing that it is very important for you to just simply modify your lifestyle, and how we can do it, we'll just elaborate on that. Can you switch the slide priorly? Yes. So now, as Dr. Nehali has already told you that there is an association called as American Stroke Association that will help you to guide that you don't have to have stroke and you can easily prevent it. So there are 4 points what you have to very much remember. First is always start any kind of physical activity. Even if it's simple walking, please start. Even if it's a stair climbing, please start. If a person is just sitting at home, it is just going to increase the body inflammation. It is going to reduce your muscle strength, your heart muscle strength, and make your lifestyle very inactive. So first thing is always switch to a very active lifestyle. Active lifestyle doesn't mean to exercise regularly. It means to keep moving and not sitting. Second is make your body habitual to exercises. How will exercises help? So it is, there are many published articles which have told that people into cardio training, or strength training have increase in the muscle strength, reduction in the cholesterol levels, and healthy heart. So if you keep a habit of doing exercises 3 to 4 times in a week, it could be a moderate to vigorous intensity exercise, or it could just be a brisk walk. That is also okay. But if you keep a progressive brisk walk, that is more beneficial for you. If you keep doing the same type of walking all the time, all the week and all the months, you will not see a change. So always keep in mind, whatever exercise you are doing, it should be in progressive manner, and try to do 4 to 5 times per week to see difference in your body. And the last is stress management and living a healthy diet with a lifestyle. What is stress? So many people nowadays, because of desk job, family issues, or anything like that, business, will have stress. Stress is a major reason for all the cardiovascular problems. It could be a heart problem, it could be a just a normal obesity, it could be thyroid, it could be hypertension, anything. Everything, the major reason is stress. So stress management is important. Be vocal about your problems. Talk to your doctors, talk to your peers about it. You can join yoga, meditation, anything what you like to remove the stress. I know it is very easy for me to say, but if you try doing this simple thing, you will see a big difference. And the last is living a healthy diet. Diet is a major part which you have to cover. If you only keep exercising and not give that amount of good diet to your body will be weak. Good exercise, good diet together will make your heart, make your brain, make your entire body healthy. What do you include in healthy diet? I'll just give you a few tips that what is to be included. Majority problem, people who have stroke have high cholesterol or hypertension. Very important is to maintain your salt intake, maintain your water intake. Your salt should not be more than 1 to 2 teaspoons per day. If it is more, your blood pressure will be higher side. Maintain your water intake. Good water intake will help to maintain all your fluids in your body. Third is to reduce your fatty substances like oil, butter, refined sugar, or refined food packets. Not eating outside food. Even if you want to eat something, kindly cook in your own kitchen. Okay. And very important is to add more of omega-3 fatty acid. What do you mean by omega-3 fatty acid? Omega-3 fatty acid is a substance which is a good cholesterol. That good cholesterol will help you to reduce your low cholesterol and improve your good cholesterol, which is required for your body to fight the inflammation. So what are the few substances which has omega-3 fatty acid is flax seeds, chia seeds, pumpkin seeds, sunflower seeds, and walnuts. These are the major things what is required for your body on daily basis to improve your good cholesterol and reduce your bad cholesterol. So if everybody thinks that stroke is only a brain problem, no, it is not. The underlying problem is your heart and your vessels. If you keep those healthy, you will be healthy. Thank you so much for hearing this out. And if anybody has any doubts, you all can ask me later. Thank you, Dr. Laya Nehali.
Thank you, Dr. Nishi. This was really insightful. And thank you for those amazing diet tips as well. So here now we have again understood that to, avoid stroke completely, we need to take care of our heart and lung as well. Our physical activity, our lifestyle, our diet plays a very important role in managing the stroke and to prevent any stroke. So I hope everyone has, understood major things, what we were trying to convey to you all about how not to stroke out. And I would like to ask everyone if they have understood this and they have any questions for me, Dr. Nehali, Dr. Nishi, they can ask us right now. You can unmute yourself and keep your videos on so that we can have an interactive question answer session. Anyone has any questions? So we had few questions asked to us on the register form. I would like to
ask those questions here on the webinar. And if Dr. Nishi and Dr. Nehali could help us to answer that, that would be really great. So this is a question, what kind of diagnostic test one should undertake to know whether you are prone to stroke?
Yeah, thank you again for the question. So there are no diagnostic tests that are specifically for stroke, but again, any risk factors which are making you prone for the stroke are the tests that you should take. For example, diabetes, it is making you more prone to stroke. Then a simple test of your blood glucose levels is something that is required. Or all these things, hypertension or lipid levels, your cholesterol levels, all these are the diagnostic tests that you can take to know whether you are prone to stroke. Otherwise, there is no such specific diagnostic test. Yes, but once you get stroke, once you start seeing the symptoms, then MRI is the gold standard. MRI tells you whether a person has got stroke. But to know if you're more prone to it, then all the risk factors that we had listed, knowing what are your blood cholesterol levels, would tell you whether you are prone to stroke.
Okay, I think the risk quiz that you had mentioned can be a very good indicator to understand if we are at any risk for stroke. Okay, I think Anuradha ma'am had some question. She has messaged. Mrs. Anuradha Chandrasekhar, do you want to say anything? Want to ask anything? Unable to mute, okay. What are new connections is what she is typing on the text. Are you saying this regarding to the brain?
Yeah. So this new connections in the sense, when you have stroke, the neurons are that, or basically your brain is made of small cells. Imagine these small bricks, for example, are broken because there is a damage to your brain. Okay. Now what happens is new connections in the sense. For example, you are trying to rebuild that wall which is made up of bricks. Once the wall of brick is broken because of stroke, you are building a new wall. That is something called as new connections. So just like that, once you have stroke, these small neurons are forming connections with each other, which are helping you or helping the brain to function normally as a whole. So once there is stroke, these small connections between the neurons are broken. So the brain as a whole will no longer be able to function normally. So what happens in stroke is, what happens after stroke is, again, it's our body's natural mechanism to get us back to what we were. So it will again start forming these new cells, which will help again to for the brain to function normally. So that is what I mean by new connections. These new connections are between the small cells of your brain.
So I hope this answers your question. So basically new connections are again different ways or different parts formed by our own body to carry out the function which was already done by your cell, which is now dead. So these are new connections that are formed inside the brain itself between the neurons. Okay, I think we'll go to the next question. Anyone else on the meeting wants to ask? Wow. So I think we have mentioned quite a few things. Still, I am going to again go through all the questions. I think we have answered the question, what happens differently in males in stroke? Is there anything that you want to add on to this? In males, is it anything different that happens?
No, there's nothing different that we see in males and in females. So the answer is no.
What are the next question? What are the don'ts in food and other things to avoid stroke and live longer? So, Dr. Nishi, would you want to say something on this? You have already told us what we should have. Is there anything specific that we shouldn't have at all?
So it's very important for us to understand two things what we don't have to do. So specifically, as everybody knows already about it, not to eat something which is much processed food, like if we get it from outside, like a packet food, processed food, because processed foods are very high in oil, are very high in salt intake, and very high in sugar. All these three things are the main reasons for starting with inflammation and starting with any diseases like diabetes mellitus, hypertension, or any heart problem or cholesterol. So specifically any food which is high in sugar, salt, refined products, bakery products, packet food, oily food from outside, it's not to be have. Even if you want to have an oily food like a samosa, please make it at home. Sweet, if you want to have, make it at home, because we know that what we add, we know the moderation, we know the amount of things what we add. So rather than eating from outside, try to make it at home. And even if you want to eat, you should always make sure that there is a portion control to everything. That's all. Thank you.
Thank you, Dr. Nishi. There's one more question. Does Botox work for stroke patients? Any one of you would like to take?
Yeah. So Botox does help. Now, when do you go for Botox? Botox is basically helpful when there is a lot of tightness in the muscle, or like we call as spasticity. So most of the times this spasticity or tightness is very well managed with physiotherapy, with exercises, or different techniques which can be used to reduce it. But in certain conditions, it is in certain cases the spasticity is so high that it cannot be managed with all these techniques. And sometimes the person has a good strength, a good movement, but just because of these tight muscles, they are not able to move. And thus, Botox is something that is now in trend, is considered as a line of management for spasticity. So Botox is again, they give it in injections, and this is given directly into the muscles. After Botox, the person will start immediately after 1 or 2 days, start feeling that the tightness has reduced. Now, this window period of reduced tightness lasts only for 6 months to 9 months post the injection of Botox. In this time, it is very important as a physiotherapist to work on that individual's strength and voluntary control, because the effect of Botox is not long lasting. After 6 to 9 months, again, the person might start developing the tightness. But yes, Botox is useful only in cases of severe spasticity or tightness. Not otherwise, physiotherapy is something that should be tried first. Dr. Lai, you're muted.
Can I?
Yeah.
Yeah.
Now you can hear me. So there's one more question left.
Yeah.
Why are
tell me, Ma.
Why are women prone to stroke more than men, and does migraine lead to stroke?
Yes. So again, like we had previously seen, women are more prone to stroke, specifically postmenopausal women, or women who are on oral contraceptive pills, or women who are pregnant. Specifically, this age group of women, like the pregnant women and women post-menopause or perimenopause, are more prone to stroke. Again, the reason is the low estrogen levels. Once the menopause is set in, the blood estrogen levels are reduced, and estrogen is something, a hormone that helps it protects you against these strokes or heart attacks. So once it is reduced, all the protective action is gone, and again making women more prone to getting stroke. And many studies all over the world have shown that women have more chances of getting a stroke. I don't know how many times more chances, but yes, they definitely do have more chances of getting stroke in a life if you compare it with the male counterpart. And yeah, the second question about migraine. So yes, there are many studies which have found that people who have migraine have got stroke. But again, a few studies which have found that there is no connections. Also, till now, there is no such established connection between the two. But yeah, we really can't say anything right now because many studies are one study saying this, one study saying something else. So can't really pinpoint to one thing. So if you ask me, then this question is still unanswered.
Okay. I think we have one question in the chat box by Lalita Aunty. Will we be benefited by intermittent fasting from stroke point of view? Anyone like to answer?
Dr. Mishri, would you like to answer?
Yes. So, it's a very nice question. Nowadays, intermittent fasting is very trending, and many of the people are following that. So, I just want to tell you, intermittent fasting works as in 24-hour cycle. So, it could be 14 hours fasting, 10 hours eating, 16 hours fasting, 8 hours eating, and some people also do more than that, 20 and 4. If they are very stringent. So intermittent fasting might work for some people, might doesn't work for some people. Why? Because many people who have diabetes mellitus or people who have any kind of other comorbidities, sudden dropping of blood sugar levels or sudden dropping of BP is very commonly seen. So intermittent fasting is a very good idea for weight loss, but it should be in moderation. So if you start with 14 hours and 10 hours, 14 hours of fasting and 10 hours of eating, you can start with that for a month. After that, you can switch to 16-8 and see how your body responds to it. Intermittent fasting has given us great weight loss thing also, as well as it maintains your sugar levels also, and maintains how your inflammation of your body is happening. So there was 2 of the articles which has read about intermittent fasting with stroke. It has given many changes. But again, if you're already at a high risk with a strong familial history of stroke, sometimes intermittent fasting doesn't work. So intermittent fasting will help you to weight loss and maintain your sugar levels. But if you ask me that it will totally eliminate stroke, that's not possible. Thank
you. Okay. I think we have answered many questions.
One question, I think so. Anuradha ma'am has raised her hand for asking a question. May I know your question?
Anuradha ma'am, do you want to ask anything? You raised your hand.
Yeah, what I wanted to ask is this: if there is a condition they'll call this Brady's bundle block or something like that, right bundle block, ऐसे कुछ है condition of the heart.
Yes, yes.
If one has that condition, then what is the impact for having a stroke?
Okay, so thank you, sir, for asking this question. So there is a condition called as bundle branch block. In bundle branch block, it is specifically a condition of heart. So I just want to simplify for other participants also. What is it called? So imagine this is, we have a wire, okay? That in heart, to increase the pumping, there is a wire which sends the signal, okay? If one of the wire is fault, the signal is not passing ahead. So your heart is not pumping the blood properly. So that is called as bundle branch block. Bundle means एक side का electrical signal खराब हो गया है, पूरे heart को नहीं मिल रहा है. So there is a very strong relation of a person who has having a bundle branch block to have stroke. How does it happen? I just want to simplify it. If a person has an electrical signal which is blocked, means the heart is not pumping the blood. अगर heart pump नहीं कर रहा है, वो blood आपके brain को नहीं जाएगा. So suppose यहाँ से signal बंद हो गया, heart is not pumping, there is no blood circulation to the brain and the person may have stroke. और suppose blood इधर ही pool हो गया है और यहाँ पे बहुत ज़्यादा clot formation हो गए हैं. Too much of pooling can cause clot formation and that clot can dislodge and go to your brain and cause stroke. So people who have bundle branch block or people who have any electrical problem of the heart are at a very high risk to have stroke. So it's very important they are on medication properly, following a particular diet and also doing exercise so that they maintain their electrical activities. And all the exercise, whoever is doing, a heart patient, should be monitored by a certified physiotherapist. If they are doing on their own, if something happens, it is their risk. So make sure the person is exercising, should be under a physiotherapist call and not doing on their own. Thank you.
Okay.
Thank you, ma'am.
Always, sir.
Is there anyone else who wants to ask any questions? We have tried our major best to, answer all the questions. I hope everyone has, got a lot of information and are now very much equipped to act and be fast if you are experiencing any kind of stroke. I would like to thank Dr. Nehali to make us understand very nicely about the stroke and how to take care about it, how to take precise care for it, and also Dr. Nishi to educating us about how to prevent stroke. Also, I would like to give you an information for heart and lungs specifically. We had recently done a cardiac and a lung assessment in our clinics, in both the clinics in Noland as well as in Chambers. We have got an overwhelming response, we have tried our best to make them understand about how they need to exercise, how they need to take proper care of their heart and lung in order to prevent n number of diseases, in order to prevent any risk factors for stroke. And it is very, very important that you know what you have to do for that particular thing. Okay, I hope the stroke seminar has been very insightful to everyone, and we will keep coming up with new seminars to educate you, to make you aware about everything that has been going on around us, especially related to health, and also why you need physiotherapy for the same and how physiotherapy will help you for the same. So I would like to thank everyone for attending this seminar. I would like to thank Dr. Nehali and Nishi as well. I hand over to Dr. Sandhya now. Dr. Sandhya, are you there?
Hello, am I audible?
Yes, you're audible now.
Yeah. Okay. So I would just like to take a moment and give an official vote of thanks. So starting off with the speakers for today, Dr. Nehali Sringarpure. Thank you, ma'am, for giving us your valuable input and your thought regarding stroke and explaining it in such a simple yet an in-depth manner to understand and act and be fast for it. I would like to thank Dr. Nishi to help us give a cardiovascular insight onto it and breaking us the myth that stroke is not just a neurological condition but has a cardiovascular aspect attached to it. So thank you for that. I would like to thank Dr. Lay, ma'am, to have conducted this session in such an amazing way and to have given her input and her thoughts to the same and adding to the session and making sure it was smoothly run. And last but not the least, but the most important one, as I must say, to all the audience that we've had today, thank you for patiently bearing with us and also giving us an encouragement to conduct more such webinars and keeping this session as interactive and interesting as possible. We will be back with such webinars soon and take precise care for yourself too. Till then, good evening.
Also, in the end, if you have any other questions, you can update us or ask us on our group Take Precise Care. And otherwise, you can also contact our clinics for any information. Thank you so much. Thank you for attending the seminar.
Thank you.
Thank you, ma'am.
Thank you.
Thank you.
Thank you, Lay, Dr. Lay. Thank you.